Okay, we're moving on to bathing and boarding and daycare personal pets. So for hourly, non-doctor, non-executive staff, you do get a discount. You don't get free boarding and daycare. Doctors and executives do get certain time frames where they get free boarding and daycare. With the bathing, you can certainly get a free bath. You should read the rules here on the bathing, but your pet has to be labeled appropriately if it's here. If you're doing a free bath, you either yourself have to do it off the clock. Obviously, we don't want to pay you and then give you free. We don't pay you to do a bath and give you a free bath as well. If you need help, the people helping you need to be off the clock also. If for some reason this policy is abused and not followed, then you'll be charged for that service and the privilege will be taken away from the whole team. So keep that as a privilege for everybody, that you can come in and give your dog a bath and use our facility and our materials. Just make sure you're not on the clock and you're not using anybody else that is also on the clock. That covers basically everything on the boarding and bathing, except that the executive directors and doctors and other executives, and we can define what those executives are up earlier in the policies manual. They get free boarding outside of these certain blackout dates that are on that page there. We have training manuals. You're on one right now, so you know the policies and procedures manual. We have an HR manual, which is private. It's for people that do the hiring, the training, and correcting. It's just the main manual for those kind of things. And the reason it's private is because we have interview questions and things like that we don't want the whole world to know, so that we can have fair interviews for everybody. We have employee files that keep records of all the training that you went through, and then we have the individual employee manuals, which is your own little binder or notebook for your procedures and your systems. Biohazard fees, we do have a lot of expenses outside of just the normal trash, and they're biohazards. And if a client ever asks why there's certain biohazard fees, there's one for appointments and visits that have just standard biohazard materials, and there's another one for surgery because there's more of those. The biohazard fee, if anybody asks, you can just use this quote: the biohazard fee helps us offset the expense of keeping our staff, our clients, and our patients safe from potentially harmful substances. Usually under $5 for the non-surgical and about $10 for the surgical. Really simple. Going to go on to the brand preferences section. So it's critical that we stay well stocked with the right products and products that we have carefully chosen and selected as what we feel is the best and has the best price and value for clients. So this may change over time. It will, because technology advances, new drugs come out, but it's impossible for us to stay completely stocked with every brand of every kind of dog food and heartworm and flea prevention. So we have to choose ones that we can stay stocked with. So as you know, we keep those in stock. These brand preferences are kept in stock, so if clients need something different, we can certainly special order that for them, but they will then need to know that it may take a little bit of time to get that, and they may be able to get it through our online pharmacy as well. But keep in mind what these products are, because it may be something different than you've used before. If you have any questions, ask us doctors, because us doctors have selected this as a group. This wasn't my decision or Dr. Nelson's decision. This was a group of doctors that came to these consensus, and there's multiple reasons for that. Going to breaks while working, I need you to read the details on that. You certainly should get a break, but don't abuse it. Cell phones, you just can't use your cell phones while you're working. Doctors in offices, execs in their own office have times where they do have their phones. That's perfectly okay, but only for those positions. If you're working on the floor in the job, you can't have your cell phone with you, and you cannot be checking your cell phone. And that's important to know, just simply because we're supposed to focus on the pet care, and it's distracting to have phones, especially to clients when phones ring, or if other clients are other employees are checking Facebook and things like that. Professional knowledge under client management. You should know certain things. You should use the courtesy in front of other people calling doctors by the doctor and their last name. Let's move on to cell phones by the hospital. That's a fairly detailed procedure, but I'll do the long and the short of it. The summarized version. If you damage or misuse that cell phone or tablet, then of course there's going to be a problem, because it's damaged. If it's damaged due to neglect or carelessness, if it's just simply an accident, we totally understand. But if it's neglect or carelessness, for that, then we're going to probably take that out of a certain amount of staff bonuses to cover that cost. So please be careful with it. And you can certainly send text to clients, but there's certain guidelines to that. And you can imagine you're not going to send certain types of text, and other times it may be appropriate, but we have to send, and under what to send, we have to send in a proper way so that it looks professional, but it also looks friendly, and it also is professional images. If you send an image of an extremely ill patient, or a patient that looks like they're trapped in a cage like the SPCA commercials, then of course nobody's going to want to see that. But if it looks like a happy pet, that's great. Send that picture. They'll probably forward it to their friends, and say something nice. Give them an opportunity to contact us. A lot of times clients like that, and we have to document it in the Avamark under the follow-up section after we do that.